So first of all, welcome to Kerala. So please introduce yourself to the audience.
Hello, my name is Pavel Banov. I'm Associate Professor in Department of Urology and Surgical Nephrology of the State University of Medicine and Pharmacy Nicolae Testemitanu from Republic of Moldova. And part-time, I'm a Vice Chief of Department of Recruitment of Foreign Students.
Okay, fine. So can you please provide an overview of Nicolae Testemitanu State University?
So Nicolae Testemitanu State University of Medicine and Pharmacy was founded in 1945 and have a good tradition to prepare students. It's only one in our country for a population above the 2.6 millions of citizens. All funds are coming in our university to prepare high-quality medical specialists, beginning from the students for MBBS, after this PG, for residency, and in continuous medical education. Our university have good traditions to prepare and inclusively and foreign students. We have more than 5.5 thousands of graduates of our university in from different countries and above of 44 in number. So all of them provide the good promotion for our university. Our programs are for MBBS are in Romanian native language, in English, French and Russian as well.
Okay. So my next question is, what does the university have to offer the international students in terms of academic exposure, and why a student should choose Nicolae Testemitanu?
So the medical education in European countries is contained from two parts of the program. Is preclinical subjects like microbiology, genetics, pharmacology, physiology, biochemistry, biophysics, so on. And these subjects not required to be in touch with patients, but starting from actually fourth year, but in the first courses like emergency medicine, the students start to communicate or to be in touch with patients. We have our university have a lot of clinical bases. It's over than 6,000 of beds in different hospitals ruled under the Ministry of Health, like in our university. So students have a huge exposure to these patients treated in these hospitals, where the academic and didactical staff have clinical practice. So in my daily activities, when I have the students, so it starts with a visit of the patient till 8 o'clock. From 8 it will be a lecture for 1.5 hour, small break. After these seminars and operation room, discussion of cases, presentation of patients, so on. So I forget what I want to tell. You will hopefully will cut.
Okay.
So let's be. During the seminars or required to the professor time, students have access to the patient's ward, operations room, examinations room. In my department is cystoscopy, ultrasound room for procedure for the patients which are treated in our department, so on. So the same is happens in other departments, so students are not less than necessary to be in touch with patients.
Okay. My next question is, what are the key criteria you look for in prospective students during the admission process?
Mainly, students, prospective students need to have good results on PCB, that is biology, physics and chemistry. They need to have very good communication skills and good English language skills. And mainly, why we are interested in Indian students is that they are highly motivated. They mainly very good speak English, and very good integrate in our university community.
Okay. Next question. Can you please describe the structure and the duration of MBBS program offered in the university?
So, as I said before, this first part is first, second, and a part of the third year are pre-medical courses, like I mentioned before, and starting with fourth year is pure clinical courses, which patients have as the module system, so they come for one of departments like neurology, it's 3 weeks course. So daily they appear and are integrated in the program of that department, having lectures, seminars, case discussions, so on, and the case presentations, and coming to finalizing with exam. Next, they come to other department. For example, gynecology is 2-month course. So the group are linked with one of the professors and study the subject, being supervised by this associate professor or professor for these 2 weeks and just like shadowing his daily program.
So next question, what resources like laboratories, libraries are available to MBBS students to support their studies?
So our university contains of more than 65 departments, which are mainly located in different hospitals with classrooms and lecture rooms for huge amount of students, so not be necessary to supply more. So laboratories were as the part of local medical service, where the our university staff have offices, and students not all together, by groups come and through the rotation pass all necessary departments, laboratories. So actually close to the student campus there is a huge library with free access for internet, with huge amount of books recently donated from United States state North Carolina. So they are always updated and for students quite enough amount to study books, but nowadays students need to have free PDF copy and to study from tablets, so having only good internet access and these places for study with free internet access the students have. And in every hostel where the students live, there is specific rooms arranged especially for the students who need to study. Somebody is early bird, somebody is night owl. So if they are meet each other in the sharing room, so that's why who are in the room will sleep, other will go to the room arranged specifically for their study. Other facilities is communication between students, sharing experience from different departments, and students association have their own spaces for team-based learning. They present their own experience that they study to each other. So this all facilitate good results of academic career.
Okay. Next question is, what support services does the university offer to help students succeed academically and personally?
So, uh, uh, if we discuss about the academic success, the professors outside of the classes are open to the students to discuss some particularities which remain unclear for the students. Of course, it's outside of the classes, and all professors mainly stay in the department above the program, and uh, every department has a student club for those who are interested in subject and want to deeper their knowledges. And for passing being in the other country, in the other culture, other whoever outside, the university has department of psychological consultants and guidance in career. So our staff from psychology departments course consult their students for those who have some difficulties in accommodation in so tough program of the first, second, third medical courses. So they have full support from not only professors but and the specialists in psychology and career guidance.
Okay, great. Next question, is there any scholarship provided to the international students, and what are the terms and conditions for the scholarship?
Of course, we support good students, and in our university, those who have more than 95% of results, it's top 5%, they will have reduces in fees by 30%, and those who are top 10 or more than 10%, more than 90% of results, they have 20% reduction of fees.
Okay. My last question is there any entrance exam required for the admission?
So according to our country regulations, the students in India, they pass +2 exam. In Moldova, it's baccalaureate exam, bachelor so-called exam, and there is no exams for entrance. It's only competition according to the average mark for medicine, like chemistry, physics, and biology. So the same rules, and like I said before, we completely not split. For Indian students, this average mark will be the competition. The average of these subjects will be the competition for the participate as the candidate for our university.
Okay. So done with all the questions. Thank you, sir.
Thank you very much.